Welcome. In a famous scene in cinema films or even cartoons, you find a dark and depressing room. And in the text, there is a chair with lights on and connected to electrical wires. And there is an eye-catcher sitting in this chair with his hands and feet tied and wires placed in his brain. When the doctor lowers the electric knife and the patient is left electric, there is a very loud electrical sound and a spark coming out of the device. The man sitting in the working chair shouted, "This is the scene." Cinema and television told us about electrotherapy, but I would like to tell you that nothing on the ground happens like this. Welcome, but before we start, if you are still new to the channel, do not forget to write a script and activate the bell to receive our videos first. The use of electricity in medicine dates back to ancient Egypt, Mesopotamia, Rome, Greece, and others. All these civilizations also tried to use electricity that comes from nature. Like, for example, the electricity produced by electric snakes or catfish. They used this electricity to treat diseases such as gout or prayer. They also used it for anesthesia, but that was the real beginning of electroconvulsive therapy. The year 1938 was a duo of Italian psychiatrists, the Italian psychiatrists Liddy Bridge, Lucy and Benny, who worked as traders, from which they concluded that electric shocks of certain degrees could still be useful in psychotherapy. But at the time, people laughed at their idea and thought it was a very Abbasid idea. Despite this negative reaction, they actually conducted an experiment on a 40-year-old man. This man was psychologically disturbed and schizophrenic. He had new symptoms of delirium and hallucinations, and through a specific device that they invented, they exposed his brain. Electrical impulses. The surprising thing is that after a few sessions of treatment with this method, this man experienced relief from the symptoms he was suffering from, and he returned to his normal state again. Rather, he returned home and went back to work. And this topic happened when the heart of the world happened. Especially since the doctors at that time were using a treatment called Tazwal. They used to inject the drug into the vein in the hope that it would stimulate the central nervous system, and that seizures or convulsions would begin to occur in the patient's brain, which might help relieve the symptoms of psychosis. But the problem is that the side effects are very bad. However, the side effects of electrolyte therapy were much less. It was easier and cheaper, to the point that they used this electrotherapy treatment with pregnant women, because it was safer for the fetus than the mother taking medications orally. With time, they began to be used with older people who could not tolerate the side effects of strong psychotherapy treatments. And that is why, at the beginning of the 1940s, electrotherapy was introduced as an effective method in treating psychological patients. With the advent of the 50s and 60s, a new era of electroconvulsive therapy has begun, and it's started to spread everywhere. The effectiveness of ECT has been officially recognized. Now in America alone, more than 100,000 cases are treated with electrolysis every year. But here a question arises. Do we even treat someone with electricity? When we electrocute someone, what will happen? What electrical impulses do when they enter the brain is that they increase the activity of neurotransmitters and their receptors. Among the most important transmitters that are affected by electrical impulses are adrenaline, serotonin, and dopamine. As these substances are affected, cases of epilepsy and convulsions begin to gradually decrease, but electric shocks help. Some areas of the brain that shrink if a person becomes depressed grow again, which is why electroconvulsive therapy is used for a large number of serious mental illnesses, like severe depression, which is the major, or depression associated with Parkinson's disease, or manic states that accompany bipolar disorder, schizophrenia, or malignant psychosis. For this reason, electrotherapy is considered one of the most successful types of psychological treatment. Many people begin to notice an improvement in their condition after only 6 sessions. Medical statistics show that electroshock treatments were effective in alleviating severe depression. About 80% of the patients who underwent the experiment, which is of course a huge percentage by all standards. Now, if there is a medical condition that needs to be treated with electricity, what should we do? Does that mean we put the power plug in and hold the wire naked? Of course, the issue has conditions and standards. First, doctors must make sure that this person is basically qualified to be treated in this way. For this reason, they must know the patient's complete medical history. Like, for example, the diseases that he had before and he was relieved of them. Or chronic diseases that he has and is still being treated for. What medications do you take regularly? Thus, in addition to this, the patient must undergo a complete physical examination, especially the heart and lungs. After we know all this, we find that the person is suitable if we electrify him, a type of treatment that we will take from his hands to begin the first session. During the treatment session, we bring electrodes and connect them to the brain in specific places. And then we turn on a special device that pumps electrical pulses and begins passing a small amount of electricity to the patient's brain. Once this small amount reaches the brain, it begins to stimulate the patient's brain through a nervous attack or electrical activity that lasts about 1 minute. Of course, doctors at this time are monitoring the case via an EEG device. We repeat this session with the patient 2 to 3 times a week. As for how many weeks we will stay, it is determined by the treating doctor. Okay, now the most important question is electrotherapy like we see in the movies? I mean, when they connect electricity to the patient, he starts screaming as if they are torturing him. The answer is, of course, no. The reason why many people have this widespread belief is the 12-year-old 1975 film called One Flew Over the Cuckoo's Nest, which is an American drama film that showed very exaggerated scenes of a patient in a hospital who was being tortured with electrocution. And the scenes that appeared in the film stuck with people, and this wrong information began to spread among others. But the reality is completely different. Electrotherapy is like any other treatment. Like in controls, what many people do not know is that the patient who receives electrocution therapy before the session begins is partially anesthetized. He takes a dose of muscle stretching, meaning he does not kick his legs on the chair, or scream or shriek. The patient remains relaxed and does not feel any need. After a very short time of the session, about 5 minutes or 10 minutes, it starts to exceed a lot. The issue of anesthesia and stretching the muscles is not something we implemented these 2 days, because the world has evolved. These procedures have been in place since the 1950s. One last thing we must clarify is that psychiatrists do not hold patients electrifying them right and left. Electroconvulsive therapy is not the first choice for any psychiatric patient. It is always the last choice. After the doctors try all the other treatments and fail to achieve results, they begin to try electric shocks. In addition, we resort to electrotherapy only in emergency situations, like patients who have a nervous breakdown and need to calm down immediately, or patients who are in a stage of depression. Do you make them not want to continue in life? Finally, is electroconvulsive therapy safe? Is there any problem with it? Of course, any treatment has benefits and side effects, and the topic does not apply to electrotherapy. Some patients have reported temporary memory loss, but in most cases, memory returns completely normal within days, and in very rare cases, they may experience permanent memory loss for certain events in their lives. Of course, we are not talking about someone losing all memory. In addition, there may be some muscle pain, headache, and so on. But of course, electrical pulse therapy has many more benefits, as we explained. Most importantly of all, it is not used for torture or anything. But are we finished? He reached here? Everything that has arrived, you are the best people. Please leave a like before you go out so we can know how many people have reached the last. Don't forget, if you have a question that comes to you at night and you're confused about how much, write it to us in the comments under the video so we can answer it. Hello,